Another exciting week. Now let's pay some attention to the ladies out there with questions on our topic of the week, which is breast cancer. Okay, let's go. Breast cancer is an abnormally rapid proliferation, yung paglago ng breast cells sa breast tissue ng isang babae o pwede rin sa lalaki. Breast cancer starts with the conversion of a single cancer-prone cell to a precancerous condition, more often described as an inflammatory process, which when left untreated can rapidly develop into a malignant or cancerous process. This cancerous lesion, when it starts, can actually spread. The term we give to that is metastasis, meaning spreading to other parts of the body from the original site, which is the breast. It can spread through the blood, what we call through the lymphatic. It can spread by direct extension from the breast to the lungs or to the ribs, and it can also spread to other parts of the body. What causes breast cancer? Actually, there are what we call risk factors. Ano nagpapaumpisa ng breast cancer sa isang tao o isang babae? First of all, we have increasing age. Habang tumatanda ang babae, starting from the age of, actually, used to be mga 40s, pero ngayon it's earlier because of the mga environment natin. Cancers can actually start at age 30, most frequently age 40. So age is one factor. They say na may mga family and personal history of cancer. Ibig sabihin nito, kung meron kayong mga kamag-anak, kapatid o siblings na may cancer, yan ang risk factor. So you should be careful when you have it, and maybe if you feel something different in your breast, then you should probably go for an early examination. Another risk factor is the irregular menstruation. Okay, some women have what we call the polycystic ovary syndrome, the PCOS, that they know it frequently asked, and this can cause other problems which can eventually lead to cancer. So another cause is late menopause. Some women have late menopause, and because of the complications of late menopause can actually trigger a breast cancer. Some people say also pregnancy. Pregnancy has something to do with cancers. Some people say the first pregnancy after the age 30 is another risk factor. Actually, there are no real definite data regarding all of these, what we hear say things. The use of oral contraceptives can also be a risk factor. Genetic predisposition, what I mentioned earlier, if you have siblings or a parent or grandparent that have histories of breast cancer, then you should be extra careful with yourself and go for early examination. Okay, if you had most of the Filipinos actually go through this what we call our tuberculosis exposures. Okay, and because of the tuberculosis exposures, a lot of Filipinos are exposed to X-rays earlier. X-rays can actually trigger breast cancer, okay? Another risk factor is what we call the hormone replacement therapy, which starts at the age of like 40, especially in females who have undergone what we call the removal of the ovary or the uterus, okay? So they need to undergo hormone replacement therapy. This can also trigger some cancers, okay? So other vices like alcohol use, cigarette use, and obesity, these are other risk factors. So these are the things that keep in mind that can be causes of breast cancer or risk factors, what we call. Breast cancers are primarily felt, first cases are felt by the individual herself, okay? It's like it's an incidental finding. Most frequently during like a bathing period, females can feel like a lump or a mass in the breast, okay? Very rarely is there pain or a swelling that will hint to a breast cancer, because basically the breast, when there's a lump, there are very few pain sensors. It's more of the a breast tissue without pain receptors. Therefore, it will not give you the symptom of pain. Presentation of breast cancer is usually a lump or a mass in the breast area. Personally, I would say ECARMA would not replace hormone replacement therapy because, first of all, hormone replacement therapy could actually be a necessity, okay? This is a hormone substance that the body requires on a daily basis, okay? Not an extra, ECARMA is a protective ingredient, and an inflammatory ingredient, and also an anti-cancer ingredient. So these two substances are complementary to each other. Okay, so you cannot say use ECARMA to replace hormone replacement therapy because there are two different ingredients. If you combine the two, it is a very good combination because the hormone replacement therapy will actually be supported by extra protection and anti-inflammation, which can actually be caused by the hormone replacement. And also, when the hormone replacement, as we say, can induce cancer, ECARMA can actually kill the cancer cells that are resultant because of this estrogen. So these two ingredients are actually complementary.